Good evening, everybody. Hopefully you can hear me okay. If somebody could just put a thumbs up in the chat or a yes or perfect. Lovely. That's great. Thank you, everyone. It's absolutely lovely to welcome you this evening to Gini's talk. I'm just going to introduce Gini, introduce the talk. Just want to draw your attention to the chat and also the Q&A. You can use either for questions, so please do put your questions and comments in the chat or the Q&A, and then there'll be an opportunity at the end. I'll try and go through some of those to do a bit of a Q&A with Gini about her talk. But first, I would like to introduce her. Gini Harrison is co-director of the Open Psychology Research Centre. She's a professor of psychology, and her work broadly focuses on mental health and well-being, particularly in relation to women's experiences across major life transitions. Professor Harrison's research explores how we can use digital tools and e-health interventions to better understand and support emotional well-being, helping to ensure that support is accessible, it's personalized, and most importantly, grounded in real human experience. So tonight she'll be shedding light on an area that's actually received far less attention than one might imagine, certainly less attention than it deserves, one might say, which is perinatal anxiety. So while postnatal depression is widely recognized, perinatal anxiety often goes unnoticed and untreated, despite being really common and potentially serious to both mothers and babies. So in this talk, she'll share some of insights from women's lived experience and discuss the factors that might intensify those feelings and explore how technology might be harnessed to help. So now I'm going to stop talking and I will pass over to Gini for her talk.
Brilliant. Thank you, Sarah. Can I just check that people can see the slides okay? Either with a thumbs up or something in the chat. Yeah, perfect. Okay, great. Thank you. Well, thank you everybody for coming. So I'm going to be talking about, well, largely about the research that I've been doing over the last decade or so around supporting mothers in pregnancy and in the postnatal period. And my reason for talking about this and getting into this actually is sort of semi-personal. So I was already working in health and well-being kind of more generally in a general population sense, and how we can support people using kind of technology for anxiety, depression and stress. And when I was pregnant with my daughter, so my first child, I really noticed that there was a real need. I'd met a lot of women who were either pregnant or with a new baby who was suffering from quite a significant psychological distress, not necessarily postnatal depression, but definitely distress. And they didn't seem to kind of recognize what it was. They didn't quite know how to talk about it. And they didn't seek help necessarily or know where to get help from. So I thought that was something that was a real gap. And that kind of is the thing that spurred me into the literature and into the research, and to see, okay, what was going on, and to really kind of start doing my work in that area. So to begin with, oh, my controls aren't working. Let's try again. There we go. So I'll start off and talk kind of more broadly about perinatal mental health. So why is it important, and what is the cost of perinatal health issues in the UK? First of all, just to explain, the term perinatal, which I'll kind of use throughout, just means peri is around and natal is birth. So it's both through pregnancy and in that first year after childbirth. But yeah, so what are the costs of it? Well, there's been a cost analysis done, and actually it's £8.1 billion a year that it's costing the UK. And that's kind of broken down into 1.2 billion being related to costs related to the mother themselves. So in terms of the health costs associated with the illness, but also in terms of productivity losses, so not being able to work, that kind of thing. but 5.3 billion is actually related to those longer term impacts and the impacts on the child, which I'll come back to later, but it's quite a significant amount of money that we're talking about in terms of the cost of the mental health issues itself. But it's not just the cost from a financial perspective, it's the cost from a real life perspective as well. And in terms of quality of life, but also in terms of mortality. And we know that between 6 weeks and 12 months postpartum, so after childbirth, the leading cause of death is actually mental health related issues. And that's recent from the Embrace report. So, you know, this is a significant issue and one that really deserves attention. But my research isn't just on perinatal mental health broadly, it's much more interested in perinatal anxiety. And the reason for that is quite nicely illustrated with this word cloud, which was produced by Katie Jones, who's a PhD student with us and works with me in this area. And this word cloud was taken from the words that people use, that mothers use to describe their feelings of distress in the perinatal period. And just looking at it, you can see that the really big words, and the more frequent the words were, the larger the words appear in the cloud. And you can see that sort of fear, panic, worried, anxious, nervous, scared, fearful, you know, they're all very anxious words. So this is really what is driving the distress or the experienced distress by women in this period. And that's also reflected actually in the literature, where, you know, we found that it is the most common perinatal mental health condition, with approximately 1 in 5 women internationally experiencing perinatal anxiety. But actually work we did during COVID showed that this actually shot up hugely. And it was between about 50 and 60% of women were experiencing anxiety in the perinatal period. So really, really quite significant. We also know from research that it is more frequent and can occur independently of postnatal depression, but there's still relatively limited research in this area, and it's the amount of research in it and the amount of attention it's received is much, much less than postnatal depression. But most people have heard of postnatal depression, but perinatal anxiety just gets so little look in and so little support that it really felt like it was something important to look into. And coming back to those consequences of what perinatal anxiety means for people, both for mother and child, there's a huge number of issues that are associated with it. And again, this is all grounded in research. So in pregnancy, perinatal anxiety can be related to preterm delivery and low birth weight. It's also related to postnatal depression. Not necessarily, but it does often occur comorbidly, they occur together. We get reduced breastfeeding rates, but also problematic feeding behaviours in mothers who experience perinatal anxiety. Bonding and attachment difficulties are also evident, and often impaired sensitivity to infant cues, so not knowing what the baby might want, you know, when it's crying, if it's hungry, if it needs changing, just not quite being able to understand those cues as well. Low maternal confidence is also related. Excessive infant crying as well, but also social and behavioral difficulties of the infant beyond this. So through, you know, beyond infancy and into childhood, we're seeing social and behavioral difficulties, but also poor cognitive development. And if you think back to that 5.3 billion, you know, the cost that was on infant costs, this is where some of those, you know, impacts on the child and the costs associated with that come in. So in terms of supporting perinatal anxiety, there isn't a huge amount of support for women with this. And very few women, as we've seen in the literature, who experience postnatal or perinatal anxiety actually seek help or will be identified as needing help. And even fewer will receive effective treatment. So there really is a gap, but why they're not receiving this help is unclear, but there are a number of different factors that probably play into it. So the first one is around individual factors, which might be that people aren't so aware of perinatal anxiety. They're aware of postnatal depression, but not perinatal anxiety. But also might be stuff like, you know, if you're in the postpartum period, you've got a baby, logistically, it's actually quite difficult to leave the house for a specific appointment to, you know, to get help, or a counselling appointment or something like that. So it could be that's playing into the individual factors for the barriers. There's also potential societal barriers, so that might be stigma. So feeling feeling ashamed and not wanting to speak about it, maybe because of maternal norms or societal norms about what mothering should look like, or people think mothering should look like. There's also healthcare professional factors, so lack of training and lack of awareness about perinatal anxiety. We know from the research that healthcare professionals are less aware of it and recognize it less. And also organizational and political factors. So just not having capacity. We already know that mental health services across the UK are quite stretched. If you are able to get support, it's often when you're in crisis rather than at those sort of lower levels of anxiety or stress or depression. So just not having the availability of services there. And also the costs associated with it might all act all together, interplaying with one another to be barriers for seeking help or getting help. Which is one of the reasons I'm really interested in e-health and how we can harness digital technology to support people. So what do I mean by e-health? Well, it's defined by the WHO as the use of information and communication technology in support of health and health-related fields. It can be pretty much anything that falls into that definition. So it might be like monitoring symptoms of things using smartwatches or things like that. It might be using online forums to discuss symptoms and support one another. It might be using the internet to look up symptoms and things like, find out information about different health issues. It might be online counselling, so literally seeing somebody face to face online and receiving support that way. It could be any of these things. It could even be like using your NHS app to look up information. So there's lots of different ways that we can use digital health to support health and health-related fields. And it feels to me that it would be really potentially quite good for this specific population because it might help overcome some of those barriers we talked about earlier. For example, we've got that heightened stigma in this group, at this time when some people describe it as the best time of your life. If you're not feeling that, if you're not feeling the way that you feel society thinks you should, you might feel quite stigmatized and not want to disclose that you are not feeling like that. You don't want people to think that you're abnormal in some way. So, overcoming that through potentially anonymous online sources of information or anonymous support can circumvent stigma as a barrier. It can also, in lots of cases, you can have information as and when you need it, or tools as and when you need them. So, in the middle of the night when you're feeling particularly anxious or something like that, rather than having to go to specific timed appointments, which can often be quite difficult if you've got a small baby. So it does feel like a potential. It's also got the fact that you can increase access to people who maybe don't have access to services in their local area. And we know that the demand is really high, but the access just isn't there at the moment. And that's particularly true because if you look at how many people now own smartphones and have potentially the internet in their pocket, we're almost at saturation point now, which means that most adults do have the ability to access things like e-health apps on their phones and in a timely manner. But importantly, it's that the research also suggests that e-health programs, depending on what they are, obviously, and how they're developed, can be as effective as can be effective for the treatment of depression and anxiety disorders more generally. They also have comparable effect sizes to face-to-face treatment in some cases, and they're generally well received by users. But not only that, it also aligns politically with where we are in the UK right now. So the recent 10-year plan that the NHS has put forward really talks about putting care back in the community and harnessing digital care so you can be treated closer to home or supported closer to home. So it aligns with all of that. So we sort of started off on this journey trying to work out, okay, well, if e-health can be helpful, what is available out there already? Is there good support or information available? So we did something called a landscape review where we literally Googled and used other search engines as well, various terms, lay terms that people might use if they were looking to get help for perinatal anxiety. And we identified about 50 sites from doing that supported or gave information on perinatal anxiety, but we found in most cases they were really quite problematic. So they were very difficult. They were not great in terms of the accuracy of information they gave about symptoms or impact treatment or screening, but particularly because they conflated perinatal anxiety with postnatal depression. So often you'd find a page that said postnatal depression and anxiety, but actually all of the information and the symptoms, or the vast majority of it anyway, related to postnatal depression and not anxiety, which means that people looking at it may not identify that they've got anxiety because they're not identifying with the symptoms or information that's listed. So real problem in terms of accuracy and transparency of symptoms and treatment information. We also found there really wasn't much in terms of actual support. So there's bits and pieces about information and symptoms, but as I said, problematically, but very little in terms of guided support or what you can actually do if you're experiencing it. And much of it really lacked credibility or an evidence base, or at least they didn't cite kind of evidence in their sites and things, which make it quite difficult to know how reliable they are. So we thought, okay, this is a real gap. So let's see if we can build something ourselves. But before you can build something yourself, we really need to understand it more because it really is under-researched as a phenomenon. So one of the first things we did was carry out focus groups. And we basically asked women quite generally actually about their experiences of perinatal anxiety, or their experiences as mothers or through pregnancy. And we also wanted to sort of ask about the acceptability of online interventions for this group. And we did this through 5 focus groups. 23 women took part in total, mostly white, British, educated, and with their first child, pregnant with or had just had their first child. And a number of themes came out of this in terms of their experiences of anxiety, but also pointing to what are the things that are really causing that anxiety? What are those triggers or sources? And the first theme that we found was really clear through all of them was that people really held these unrealistic expectations of both birth and motherhood. And that was across the perinatal period. So starting with pregnancy and childbirth, people really held unrealistic expectations of what it would be like to give birth or have a baby. And they often felt like it was very unrealistic and poorly managed. As one woman said, I felt there was a lot of misinformation about what an intervention would be like, which made me unnecessarily anxious. So they felt often they were being pushed into a natural birth, and that any form of intervention was kind of couched as quite scary in the scary terms, which caused a lot of anxiety for women, and they really didn't know what to expect. Other women talked about having a birth plan and, again, encouraged into this sort of often very natural style birth in their birth plan. But then when things didn't go to plan, that completely sort of shattered their expectations and left them feeling really quite anxious and like they'd failed. And that came up quite a lot, actually. Beyond birth, there were also, this one came up literally in every single focus group that we held, and it comes up all the time, is expectations of breastfeeding. So women felt really underprepared for what breastfeeding is really like, and they felt quite shocked and anxious when they encountered difficulties. As one woman said, antenatal classes show you this video of a 5-month-old baby breastfeeding quite happily in some sort of coffee morning, and it's absolutely easy. But then the reality is so different, and I felt just a bit tricked by the whole lead up to having a baby. And again, it's that management of expectations, that sort of idealized image of what people were expecting versus the reality that seemed to be causing the anxiety here. And this was also true of guidelines and norms that came up quite a lot. So often you get these developmental milestones on non-focused websites or on apps that tell you what your child should be doing, and it's always should be doing at different times. But of course, what people don't say is these are often median values or average values, and not every baby will hit that, but that's not described in these terms. And so it really causes anxiety when your child doesn't do that. So as one mother said, it worries me when things like baby centers say at 8 months your child should be doing this, especially sleep and feeding. You feel like you're just doing everything wrong. but also the guidelines about how children should be feeding or how they should be sleeping also were felt to be quite unrealistic and causing anxiety when people weren't able to live up to those, and no sort of solutions or alternatives were offered. As one woman said, I don't know any mum who was able to put their child in a Moses basket on their back from day one, and it just causes you an enormous amount of anxiety. So what are you meant to do? So again, it's sort of it's not just causing anxiety, but there's so much uncertainty and not knowing what the right thing to do is that's causing this kind of unsettled and anxious feeling. Another theme that came up was judgment and stigma. I've mentioned stigma already as a barrier, but this came through quite clearly as well. So the first one, sub-theme, was societal pressure. And many mums felt like a significant pressure to be what they believed was the image of the perfect mum and to do the right thing. And they felt that in social and mainstream media, they were often seeing these unrealistic images of people. Like one of the examples that was given was a celebrity who'd recently given birth, standing on the steps of a hospital, looking manicured and perfect with their hair done and all the rest of it, looking absolutely brilliant straight after giving birth. And that just, you know, they're there at home and that's not their reality at all. And of course, social media is a highlight reel that only shows you the best bits of people often, and you're sitting there in your real life context and you're comparing yourself to this highlight reel, and it's never going to be a fair comparison. And so a lot of people feel that that puts an awful lot of pressure on them, and you know that they're failing basically. And as one mum said about the kind of significant pressure about wanting to be the perfect mum or do the right thing. Again, this came up around breastfeeding, and they said, I think they put so much pressure on a mum by saying breast is best, which means, yeah, it's all positive. But if you don't succeed, then you failed as a mother, you failed your kids, which, you know, is sort of setting you up to fail. And there's also the mental health stigma and disclosure. So feeling ashamed of the symptoms and reluctant to disclose them because people feel that they should be living up to these societal, these, you know, constructed social norms, which aren't real. You know, as one person said, and it's quite significant. It's not just about being ashamed or embarrassed. It's actually real fear that if you disclose something and you think you're abnormal, that somebody might take your children away. And that came up quite a few times. So as one woman said, I fear that if I went to somebody saying, look, I really suffer from anxiety, I get worried on who's going to get involved with my kids. And it's a real fear, which prevents people from disclosing. So another theme that came out quite clearly was peer support. And I've put support in inverted commas because actually one of the issues here is that it's not always supportive. And that was one thing that we weren't necessarily expecting to find, but online forums were seen as negative when they were large forums. So things like Mumsnet, they were often found to be quite anxiety provoking rather than relieving. And that's because there was often quite a lot of conflicting information on there, or polarizing opinions, and people having very strong opinions, which just left people who were reading it feeling confused and uncertain and not knowing what to trust and not knowing what to do. But you also got quite extreme information on there as well. And as one mother says, it definitely increases anxiety. Those big forums definitely do, because nobody wants to post when things go well. They just say terrible things. That just made me feel really paranoid. But it's not all bad, because actually forums were seen as really positive, and peer support was seen as really positive in different ways, but particularly when they were smaller and more focused forums. So small forums around sleep or around gestational diabetes or something like that, where you've got that quite specific focus, and you've got that expert by experience mentality and support kind of coming through with mums telling other mums, or how, you know, how they got through it, or what their experiences were. And peer support, I should say, offline was still seen as more important than online support. But it didn't really matter where that support was coming from. So whether it was online or whether it was in person, the kind of mechanism through which people found it helpful was this normalization of experience. So share, you know, reading other stories that you can relate to, real life real life stories. So women felt that they weren't alone and that someone else understands. And again, it promotes the idea that it's normal to deviate from these social ideals that we've constructed. It's not normal to be perfectly manicured immediately after having a baby. And as this quote says, it was one mum, it was so refreshing. She said, I didn't really enjoy it until he was 6 months old. And something clicked in my brain then where I was finally like, oh, somebody. And suddenly just having someone say it took the pressure off and I could start to enjoy it and give myself a bit of a break. So it's really, really important. This normalization of experience and realizing you're not alone is crucial, really. Another theme that came out was this lack of maternal confidence and feeling of overwhelm and uncertainty. Many women describe struggling with that adjustment to motherhood, and often due to just not knowing what to expect. We used to have multi-generational learning where we would see different generations bringing up their kids, and now we had this in the focus groups. People particularly who weren't born and bred in the UK and their family was abroad, they really struggled with not having that intergenerational knowledge and intergenerational support. And many really felt out of their depth and found it really difficult to balance the demands of everyday life alongside, having this new baby and not knowing what to do, and suddenly feeling like you're not good at anything because you're suddenly thrown into this completely new situation where you know nothing. And as somebody said, I suppose we all go through our lives being good at a lot of things. You've established a career, you've established yourself, and then suddenly this baby arrives and you're not good at anything. And that came through in quite a few of the quotes. But as well as that, a general lack of mental health support and knowledge was acknowledged and was another theme that arose. And as one person said, part of it was about lack of knowledge and support from healthcare professionals. So them not recognizing it or not understanding it. And as one person said, I think that's why you get the anxiety, isn't it? Because you're all geared up to give birth and then you do it and you get home and you're like, shit, now I have a baby and there's no support really. I had really bad postnatal anxiety, like full on, but no one spotted it. So this kind of lack of mental health literacy, so really not understanding what perinatal anxiety is, at both a general public level and people not recognizing the symptoms in themselves, but also at this healthcare professional level as well is deeply problematic. And women often felt distressed because they weren't able to find information about it. And they did look online and offline and weren't able to find it. And many didn't identify with postnatal depression symptoms, which, as I said at the beginning, if you did find evidence or information around perinatal anxiety, it's often conflated with or put with postnatal depression and kind of given a backseat. So they weren't identifying with it, which also lent them to think a lot of the time, because they didn't identify with it and they didn't know what was going on, they just felt they were going mad and they didn't know what was happening or they'd lost the plot. So again, just not really knowing what's happening, is not having that mental health knowledge was really an issue in terms of anxiety. But what we did find was online support was attractive to people in the perinatal period. They said that the anonymity can be really helpful to overcome stigma and promote disclosure. As one person said, I felt like I couldn't talk to anybody about it because I didn't think it was normal and I felt like it was me not being a good mum. So instead, I spent a lot of time looking things up and talking to other mums on the forums, and that it feels, I don't know, safer or something, because you can just say whatever you want and no one really knows who you are or is going to judge you. So yeah, I think I am happier looking for support and help online. And flexibility also was seen as a bonus. As one person said, the good thing about online is that you can just go on it whenever you need. I had a C-section and that makes it very difficult because you're very limited. You can't go anywhere or anything like that. So I think having support online would be a good thing for that, because of course you're housebound. So they sort of speak to the earlier barriers that we identified earlier. And not only are they barriers, but they seem to be things that mums are recognizing as barriers and want to overcome. And they also gave quite a lot of suggestions for what online support might look like. All of this comes out of the quotes and things and the themes that we've just gone through, so that they really felt that whatever is given to them online. It needs to do a good job or a better job of preparing them, managing expectations of birth and motherhood, a need for realistic, unbiased and balanced information. They wanted expert advice and evidence-based information. They also wanted peer support and peer stories. So whether that was through a moderated or small forum, or maybe exposures to other mothers' stories to really normalize their experience and break that kind of societal norm. And they also wanted information about perinatal anxiety and symptom management. So both information about symptoms, but also information about how they can manage it in real terms. But we didn't just ask women as well, we didn't just conduct these focus groups. And this was very much led by my PhD student, Katie Jones. So we carried out a systematic review and narrative synthesis, basically to see, okay, well, we've spoken to women, but what's happening in the literature? What are these risk factors that might be leading to perinatal anxiety according to the papers? So the review covered 39 reports in areas which have quite similar internationally, but that have relatively similar healthcare systems. So the US, Australia, Germany, and the UK. They did use a huge array of perinatal anxiety, or in this case it was postpartum anxiety measures, and some used structured clinical interviews. They were quite different in their approaches. So we weren't able to do a meta-analysis where you kind of take all the numbers and put them together. So it was more of a narrative analysis to tell a story of what the literature is saying. And through that, we identified basically 7 risk factors, or 7 kind of themes of risk factors that were associated with postpartum anxiety. And some of these are things that we can't really change, or we couldn't really easily put into an online intervention, for example. So, for example, the socio-demographic factors is one factor. We can't really do much about that. Things like income and education and age and gender. We can't really, immigration status. We can't really do much to change that. Also psychopathology and personality. So that was really talking, this was a risk factor and was related to higher chances of having postpartum anxiety, but it relates to your previous history of mental health or your personality characteristics, again, which are quite hard. They're not really modifiable. They're not targets for an intervention. Other things like health and experience of pregnancy, of birth, again, less modifiable. So, that the actual experience people had of childbirth, we can't necessarily change that in an online intervention. So the things that we really wanted to focus on were these modifiable factors. So the things that we could potentially target in an intervention that we could potentially put into something online. And the 2 things that I'm really going to focus on here are the cognitive factors and also partially the social factor. But they came out as quite significant predictors or risk factors for perinatal anxiety, postnatal in this case. So I know there's different people in the audience today, so I'm just going to take it back a little bit and just explain what I mean by cognitive factors. So the word cognitive just refers to our thoughts, beliefs, and mental processes. So it's how we think about ourselves, others, and the world, really. And that's really important because in many models of how cognitions work with everything that we do, we think that there's a sort of interrelationship between how we think and how we feel, but also how we behave. And the power of cognitions or thoughts is really, really huge, actually, because it's actually the way that we think about a situation that might cause distress rather than a situation in itself. So to illustrate that, I've just got an example here. So imagine that we have 2 people, both are new mums whose babies are crying at 3 a.m. despite being fed and changed. The way they interpret it determines their feelings and their subsequent actions, which can either alleviate or exacerbate their symptoms. So the first mum might think, oh, this is really hard, but babies cry for lots of reasons. It doesn't mean I'm a bad mum. And they might be frustrated, they might be tired, they might feel, a bit, annoyed by the situation, but generally speaking, they're still relatively calm. Their physiological symptoms are relatively okay. They haven't kind of shot through the roof. And that in turn, those thoughts and those physical feelings will lead to behaviors, which might be, okay, I'm just going to take a breath, I'm going to take a break, I'm going to make myself a cup of tea, I'm going to get help from my partner, I'm going to, it could be something like that. Alternatively, somebody in the same situation might think, oh, why can't I even settle my own baby? I'm a terrible mum, everyone else can do it. And this kind of negative thought can lead to you feeling quite tense, which can lead to physiological symptoms. So you can get quite fast heartbeats as you get more and more tense, feeling anxious, overwhelmed, maybe guilty. And these feelings again can be related to behaviors. So people might withdraw because they're feeling like this, they're feeling like they're a bad mum, they don't want to ask for help. They might scroll social media and look for things there, but then, inevitably see these pictures of people who appear to be doing it better, which again makes them feel like they're failing. And so the cycle goes on and on and on. So the idea is that, the thoughts can be really powerful in terms of driving our behaviors, and also how we feel, and lead to anxiety. And one particular type of not great cognition that I'm going to concentrate on is one called repetitive negative thinking. And this is one that we've done quite a bit of research on. And this basically means, when you get stuck in a loop going over and over and over the same things, the same negative thoughts, and can't easily stop it. It feels uncontrollable, and it can cause but also maintain anxiety and low mood because it keeps going. And this can be this repetitive negative thinking, like the content of the thinking can be worry, so it might be about the past, or it might be rumination, which is about the future. And we carried out in 2022 a scoping review of 87 studies, which basically looked at repetitive negative thinking to see what its role was in perinatal anxiety and depression. So we looked at both in this. And we had a whole host of different studies that were included in this, some cross-sectional, some longitudinal, and some were sort of treatment evaluations. So trying to target this as a potential modifiable factor, cognitive factor. And the paper found that, unsurprisingly, repetitive negative thinking was linked to higher depression and anxiety symptoms in the perinatal period. But worry was generally a more reliable predictor than rumination, but both were involved. In terms of the interventions that were designed to target repetitive negative thinking and try and stop people, it did show potential, but it was the studies are very much in their infancy. Well, some were RCTs, randomized controlled trials, some were pilots, but it's very, very new, and more work needs to be done, and there's more development of interventions to test. But it's unlikely, and the paper sort of indicated that it's probably not just repetitive negative thinking on its own that's causing anxiety and depression. It's probably got an interplay with lots of other different factors, like those risk factors we saw earlier from the systematic review, that's kind of exerting its effects or alleviating those effects on mental well-being. And one thing that we found from a different study that we did during COVID was that social support is actually quite protective. So we did a study of over 250 postnatal women. So again, we're in the postnatal period. And we measured their propensity for repetitive negative thinking. We measured their depression scores, anxiety, but also their perceived social support, and also use of digital communication. And we found that both repetitive negative thinking, again, was related to depression and anxiety. So the more you do it, the more likely it is you'll be depression and anxiety and anxious. But also that social support was strongly associated with it too, in an independent way. So the more social support you have, the less likely you are to be anxious, and the less likely you are to be depressed. But there was also this interaction between these factors, so that people who had high levels of social support, that relationship between repetitive negative thinking and anxiety or depression was actually much lower when you had social support than if you had high levels of social support. If you had low levels of social support. So if you didn't have that social support, the impact of this repetitive negative thinking on your mental health was much higher, much stronger than if you have social support around you. And it's not just social support generally, although that was significant. When we teased it out to see, okay, what types of social support are the most helpful here, it was support from friends or peers that really drove this buffering relationship between cognitions and how people feel. We also found that forum use was linked to high levels of repetitive negative thinking again, and poorer well-being. So again, showing that these big forums aren't necessarily a good thing for mental health. So how can we target this? Well, cognitive behavioral therapy is one way, one intervention that we could potentially use. So again, not sure how much people know about CBT. So just as a kind of back to basics, it's based on that idea again that I showed a second ago about thoughts, feelings, and behaviors being interlinked. And it works through a bunch of different ways. So it will help you to try and identify the unhelpful thinking patterns that you might have. So notice when you're ruminating or worrying, what triggers it. And then challenge any of those thoughts that you're having. So is this thought a fact, or is it just my mind's interpretation? Is it real? It also can give you techniques like mindfulness that teach you to step back from your thoughts rather than getting pulled into them, which kind of help to break that spiral, but also to test unhelpful beliefs. So if something that's driving, one of the worries that you have is that I need to check my baby every 5 minutes or something terrible will happen, it kind of encourages you to test that, maybe delay checking. So it's not every 5 minutes, or distraction, call a friend for a bit, then go check. And the whole point of that is to show that the thing that you're fearing, or that anxiety that's kind of going round and round, isn't actually real, and kind of can help to break that cycle. And also that can teach you different types of coping strategies, so problem solving, positive activities, behavioral activation, self-compassion techniques, so that it's all of this is kind of built into CBT. But the nice thing about CBT is that whilst it's often delivered in a face-to-face manner, it actually lends itself really nicely to be manualized or delivered online. And a lot of these tips and tricks you can kind of develop into an e-health intervention that people could do. And that's actually what's been done. So in Australia, there is something called Momentum, which is perinatal ICBT. So I just means internet-based cognitive behavioural therapy. It was developed by CRUFAD in Sydney, so the Clinical Research Unit for Anxiety and Depression. And there's two arms to it, pregnancy and postnatal. And it uses the kind of CBT model that I just mentioned alongside other things as well, but mainly CBT to reduce anxiety online. And over in 2023, we did a sort of real world examination of how people were using this program in Australia. And we had 1,500 women, just over that. Some of them were prenatal, some of them majority postnatal, and just wanted to look at how they were using it and whether it was effective for them. Now, 35% of women who were pregnant completed all 3 lessons. So each one is sort of split into 3 parts, and they completed all of it. 41% in the postnatal group completed all 3 lessons. So it's by no means everybody, but that's not necessarily a bad thing. I think a lot of people think dropout is a bad thing, but sometimes people drop out of these things because they've got what they've needed already. The important thing really is to look at, okay, what's the effect of it? And we found that there was a significant and quite decently sized reduction in anxiety and depression and psychological distress from using this program, which really shows that CBT has a role to play in potential support online for this group. But the problem is the study was only for Australian residents. There's no control group, it's just pre-post. And it's not available in the UK currently, so that there is still this gap over here. We have tried to bring it over here, but unfortunately have not had success with that so much. So if we look at everything that I've talked about in terms of the different studies and the different approaches we've used to kind of do research in this area, what are the recommendations that we've come out with? Well, the first one, thinking about the systematic review, which is very much Katie's, thinking about the risk factors that we saw there. There are 7 that we've identified, some of which could be used as a kind of early monitoring risk detection if we embedded that into perinatal care in some way, shape, or form. And we know that people with pre-existing mental health issues are more likely to have perinatal anxiety. So again, maybe monitoring people with a history of depression and anxiety would be helpful. The other thing that we'd recommend is increased access to information and support. So harnessing digital technology to fill this gap where possible, using it to provide professional evidence-based support and psychoeducation. So education around the symptoms and signs and treatment to help alleviate the confusion and uncertainty that women feel. Again, increasing knowledge and awareness of perinatal anxiety, both at the general population, but also in healthcare professionals to help that better identification of symptoms so people can get appropriate help, but also to signpost to suitable evidence-based support strategies, including cognitive behavioral therapy. In terms of the approaches to support, non-medical and community-based peer support seems to be really helpful at breaking down those societal norms that are driving a lot of the anxiety. And it can, enhancing these peer connections can also mitigate that cognitive risk, though, that relationship that repetitive negative thinking might have on how people's mental health is. But also integrating repetitive negative thinking focused strategies into care in some way. And that might be through ICBT programs, cognitive behavioral therapy programs. It might be through different methods, but also including other cognitive support strategies where appropriate. And really just better managing people's expectations of motherhood and childbirth, because that seems to be really, really significant in terms of the trigger. So providing honest evidence-based information about what it really looks like and what it really means, and challenging these unrealistic socially constructed ideals of motherhood. So whether that's through maybe a library of experiences, women telling their story through videos, it's already being done to some extent with quite a lot of humor actually on some social media accounts, so it can be used for good, obviously, but I think we really need to break those ideals. And I should also say that all of this work is being done not just us kind of sitting as researchers thinking, oh, let's do that. We have a huge amount of patient and public involvement. So we work with midwives, health visitors, public health services, and voluntary and community sector organisations to make sure that what we're doing can potentially work on the ground and is filling a gap where it's needed. And there are specific areas where women really are underserved, or birthing people really are underserved. So whilst the kind of mental health support is really geared up for complex needs or severe issues, it's not so good for those with mild to moderate levels of perinatal anxiety or any psychological illness, actually. Those within 6 weeks of birth are particularly under-supported. And those who are, even if you're getting help, there's often really, really long wait lists. So we could be using eHealth to support people whilst they're waiting, which may mean that they then don't need to see a specialist at the end of it, which again will kind of speed up how quickly people could see them. But also the postnatal context has been flagged as the real area of need here rather than pregnancy. And I think that's because when you're pregnant, there are quite a few touch points with midwives and healthcare professionals, whereas that's really lacking in the postnatal context. So in terms of what's next, well, what we want to do is build a tool that can help people. So we'd already started to build something called Open Pause, which we're changing the name of now, but perinatal anxiety, and it will be wellbeing support. And really try and use all of that information that we've got through our research to embed in this, but also run CPD based on the work that we've done with people who are working with perinatal populations to help them better recognise perinatal anxiety and support them. So yeah, that's our what next. And yeah, just to say thank you to everybody that we've collaborated with, whether research institutions or healthcare professionals or third sector, and thank you to the research team.